Paramedic Kendall Rose, and today I'm going to be talking about occlusive dressings and how do you help somebody if they are injured in the neck or chest, abdomen, or even their back. So an occlusive dressing is something that is airtight. They've got a hole somewhere and we're going to put this on top of it in the neck, chest, abdomen, or back. It could be a sandwich bag. It could be that maybe you've used your combat gauze. You have this. We can put this on top. Or it could be a commercially available chest seal, which is what we like to use in EMS. So they come in packs of 2 because you may have an entrance and an exit wound. You have to look for both. All right, so we've got this patient here. It looks like there's some type of injury. We can see there's a hole in the shirt, but you've got to expose and you've got to take a look. We have found a gunshot wound that looks like maybe the entrance wound. Exit wounds could be these big blowout wounds depending on what type of caliber of gun it is. So we'd look all over the patient, right? We turn him over, gonna look in the back. You'd look the entire patient. Many times you cannot tell the path of the bullet, where it's gonna go. It might be through and through, or it could have exited somewhere else in the body. But I see this. So somebody who's been shot in the chest is gonna have difficulty breathing. They may have something called a tension pneumothorax, which is a buildup of pressure within the chest cavity. It collapses the lungs, causes a lot of issues for the patient. Our job as immediate responders, so your job out there, my job, if I'm an immediate responder, just walking through someplace and there's a gunshot wound and it's safe to go and help the person. Our job is to simply cover that hole. I say from chin to belly button. If there's a hole anywhere here in the neck, chest, abdomen, or back, you want to get an occlusive dressing on, an airtight dressing, because our goal is to stop the air from going in. So in this case, I'm going to take this. This is one of the commercial devices, a hyphen. Get these on North American Rescue. You pull it off, you're going to see that there's like a little center here, and you're simply going to center that on top of the wound. You can see it's super sticky, and this is a training one, so the real ones are super, super sticky. Gonna put that there. You can see they have these like little, I don't even know what's a canal maybe thing that you want to call, where blood and stuff can go out, but eventually they're going to get clogged up. So one, we've sealed it. We don't see any exit wound. We have this sealed, but we have not gotten all the air out for sure. So we do something called burping. Which burping is they're still having trouble breathing. You're just going to lift up one end of it, let them exhale, seal it again. Again, lift it up, let them exhale, seal it again. The EMTs get there and they'll put on a commercial device. And then the paramedics will arrive, and if they're trained in your area to do this, they will decompress the chest. And what we do is we go between the 2nd and 3rd intercostal space, or between the 4th and 5th anterior or mid-axillary, and we will pop a big needle in over top of that, and that will let that air escape out. We call that decompressing the chest. But nothing that we have done has fixed this patient. And so our main goal is to do what we can to keep them going long enough to get to the hospital. They will put a chest tube in, hook it up to suction, be suctioning things out, and then we'll get the trauma surgeon in, who's going to be the one that's going to come in and fix this patient, hopefully. So again, that's an occlusive dressing. An occlusive dressing can be anything that is airtight. Our job is to get that on top of the hole from chin to belly button. Look for all exit wounds. And if they're still having trouble breathing in the chest, you're going to burp it, lift it up, let them exhale, seal it again. And you might do that many times. Now let's say, I'm going to take this off right now. And this guy doesn't really actually have a neck, but we're going to pretend he does. Where did my little thing go? So we're going to pretend this guy, he's just a mannequin that I've kind of rigged up to be one of my trauma mannequins. You could put a nasal airway in him and everything. All right, so this is done here. So let's pretend that he has a neck. And again, he looks like a robber, because this is what's kind of holding on his face there. So somebody is shot or stabbed or anything in the neck. Number one, we worry about it penetrating one of the big arteries. Our main goal there, if we have bleeding in the neck, is to put direct pressure on it. If it's low down, lower down in the neck, and you're not going to pack in and crush that airway, obstruct the own airway with your packing, you could choose to pack that with hemostatic gauze or regular gauze. But again, you got to weigh that. Am I going to be pushing the trachea and pushing off the airway? We don't want to do that. But another thing you must get on if it is a neck wound, because we have these big vessels here, the external, internal jugular, the carotid, they're huge vessels. And when they're open to the air, they can actually suck in the air. And then the air travels through the body, and that is what we call an embolism. So not only will you be putting direct pressure on that wound, perhaps packing, if it's lower down, we're not going to obstruct the airway. You're also going to be getting some type of occlusive dressing on. Now, he doesn't really have a neck. I'm just going to go ahead and use this. So here, I am going to get that sandwich bag on, and I'm going to keep direct pressure on, and I'm going to keep that occlusive dressing on there so no air embolism can form. That's how you would handle a neck wound. And you're going to be very conscious of, do they have spinal cord injury as well? But if they've got a spinal cord injury and they're bleeding to death, they will bleed to death unless you intervene. But do the best that you can to keep their neck still, and just worrying about any type of injury to the spine from, a penetrating trauma to the neck. All right, that is it. So that's the occlusive dressings. And again, for occlusive, from chin to belly button, front and back, neck, we got to get occlusive dressing on along with direct pressure. Chest, and by the way, what I see a lot of training scars are that I see when I teach around the country is we'll do these, training, these large events, and I see them coming on and they slap it on the shirt. Now, I go, congratulations, the shirt has lived and your patient has died. The occlusive dressing has to go on directly over the skin, because if you got the shirt in between that and the occlusive dressing, it is not going to form a seal. So again, has to be on direct skin. And what are you going to do? Let me know in the comments. What are you going to do if that patient is still having difficulty breathing? What did we say you're going to do until the EMTs and the paramedics get there? Let me know in the comments. This is Paramedic Kendall Rose signing off. Have a great day.